Presenting ultra-wide field angiography based prediction of proliferative retinopathy in retinal vasculitis.
Thank you. Good morning, everyone. So I have no financial disclosures to make. Slide is not moving. Okay. So laser photocoagulation is the primary treatment for managing neovascularization in retinal vasculitis, and it may help prevent neovascularization in high-risk cases as well. Ultra-wide field angiography plays a crucial role in deciding the and guiding the treatment in such patients. However, risk stratification studies in retinal vasculitis are very limited, and they focus on capillary non-perfusion area, extent, and location measurement. Out of the two studies, this is the first study that is there published in 2017, where Sharif et al. They measured the capillary non-perfusion area as percentage of the total image area in pixels using the manual measurement function in image J, and they found that the ischemia, which is covering more than equal to 2 quadrants, is a significant risk factor for neovascularization. However, there are concerns with this model of CNP measurement, that there is peripheral image distortion that happens in ultra-wide field imaging, and so the area measurement will be inaccurate in the periphery. And there will be factors which will affect the total amount of interpretable fundus because of blurring in the periphery as well as eyelash artifacts. Now, another study in 2019, it divided the fundus into 3 zones. Zone 1 including the posterior pole, then zone 2 between posterior pole and equator, and zone 3 anterior to equator. And they found that presence of posterior pole disease is a significant risk factor for development of neovascularization. However, the concerns in this study are there are no cardinal points that are described for zone 1, zone 2, zone 3. There is no differentiation between neovascularization at disc and elsewhere, and there is no correlation that is made with disease activity. The aim of this study was to determine the association between ultrawide field features and development of neovascularization in eyes with retinal vasculitis and suggest a simple, reliable, and practical approach. It was an ambidextrous study performed at the Retinal Lab and Vasculitis Clinic at RP Center over a period of 2 years, wherein ultrawide field imaging and clinical data of patients were assessed. The inclusion criteria included good quality ultrawide field angiograms of retinal vasculitis patient and available clinical data. Exclusion criteria being poor quality of angiograms, media opacity that did not allow assessment of CNP or vascular leakage, predominant uveitis being it intermediate posterior panuveitis, and missing clinical data. Assessment of angiogram was performed on optos by an experienced specialist. The grading of CNP was performed based on the preliminary data that we obtained from the retrospective patients. We divided the fundus into 3 zones. Central zone 1 of 6 mm radius. These annotations were done on the optos software. The central zone of 6 mm radius, mid-peripheral zone of 6 to 15 mm, and peripheral zone beyond 15 mm radius. Now, dynamic use of all the images in the phase were used to cover all the quadrants thoroughly, and then clockers in zone 1, zone 2, zone 3 were identified. Leakage was categorized as no leakage, mild leakage, and profound leakage, both for perivascular leakage or capillary leakage and disc leakage. The outcome measures were systemic features and treatment parameters, then features of vasculitis, coexistent features, and angiographic parameters. Logistic regression was performed to identify predictors of neovascularization. Ultra-wide field images of 396 patients were reviewed. However, only 171 images of 171 eyes of 117 patients were found suitable for angiographic analysis. The median age of these patients were 28 years, predominantly males and predominantly bilateral disease. Some had systemic illness at the time of assessment and were on systemic treatment, anti-inflammatory treatment as well. Active vasculitis was present in 40% of the patients with predominantly venular. Proliferative disease was present in 54.4% of the eyes. Now, when we did the univariate analysis, the significant factors were state of vasculitis, type of vessel involvement, disc leakage, and perivascular leakage. In analyzing the capillary non-perfusion area clockers, we found that was also a significant risk factor, higher in eyes in which neovascularization was present. Now, odds of neovascularization at disc, if we see, if the capillary non-perfusion in zone 1 was more than equal to 3 clocker, it was 10-folds. And if we see neovascularization elsewhere, then capillary non-perfusion area, if it was more than or equal to 3 clockers in zone 2, then it was nearly 5-fold. On doing the stepwise multivariable logistic regression, we found that independent factors that were for neovascularization at disc was zone 1 capillary non-perfusion clockers. For NV, it was zone 2 capillary non-perfusion as well as disc leakage. However, disc leakage was found to reduce the odds of NV. Now, we calculated the area under curve for these 3 models, and the area under curve for all these 3 models were more than 0.8, that is good. And for neovascularization, any neovascularization, it was 0.8, that is high. So this study showed that zone and amount of capillary non-perfusion and angiographic leakage were found to be independent predictive factors for neovascularization in retinal vasculitis. So zone 1 capillary non-perfusion, it increased the odds of NVD development. Practically, if we see it, this is the area which is involving the posterior pole, and capillary non-perfusion in zone 2, that is between the posterior pole and equator, it affected the odds of NV. That is practically, if we see, it is the mid-periphery. And the isolated CNP in zone 3 did not affect the odds of neovascularization. Now, angiographic leakage, we saw that it did not affect the odds of NVD, but it did affect the odds of NV. Now, limitation of the study is that it's a cross-sectional, predominantly a cross-sectional, and need larger
Your time
cohort
is
studies.
Up, huh? Try to wind up.
Yes. To conclude, this study offers a simple, practical, and reliable approach without distortion-related inaccuracies which are there in the existing models of CNP area assessment. And prophylactic laser could be applied based on ischemic zone involvement and disease activity to prevent complication in these patients. Thank you. These are my references.
What were these cases of these vasculitis?
These
What was
were
the
predominantly
etiology?
vasculitis.
No,
And
etiologically, I'm
so
saying.
majority of them were idiopathic. Systemic disease was present in only 15 of the eyes out of 15 of the patients out of 100.
So what was the systemic disease I'm asking?
Systemic diseases, 5 patients had tuberculosis, 3
Okay.
had pulmonary, and 2 had lymphadenitis. 1 patient had psoriasis, then 1 had SLE, 2 had Behçet's. So I had mentioned that in one of the slides.
One thing, it's a nice study, but it would have made much sense had you really talked about the predictive value. That means instead of cross-sectional, it should be a prospective study, and
So
then you comment that again is a better thing because
Limitation
you are
I mentioned that
predicting. Yeah.
So out of the 117 patients, 83 patients I had mentioned that 83 patients were retrospectively included and 34 patients are prospectively included, and now we are following those patients to actually see what is the relative risk. Now I have presented the odds, but relative risk we need obviously a larger cohort.
So you treated them with laser, all of them? Or with
Those patients who had neovascularization, they were later on treated with laser, but that was not part of the study.
anti-VEGF? No, I'm just asking you what you treated with. Since you're doing this, so finally the treatment is what is going to
Yes.
get affected, no?
So we did not.
So what was the treatment you did for NVE and NVD? Like,
So for NVE and NVD, we did laser. For NVD, we routinely do a PRP, and for NV, we do a sectoral or scatter
sectoral laser. Any anti-VEGF was used in any of these patients?
Anti-VEGF.
Okay.
For the study, as you've mentioned that if the CNP area is in the zone 3,
Zone 3. Yes.
there's not much of a odds to
So
develop,
anterior to
right?
the equator, it did
Yes,
not
so
affect
it's
the
only in
odds.
zone 1 and zone 2 if
Zone
you have
1 and zone
CNPs,
2.
it creates more of a positive production for us. So how do you justify your comment on ultrawide field imaging base that's much better than compared to a conventional which we use?
So still ultrawide field will give us a view till the equator. And now this is a model in which we have used the zone 3 to calculate and see whether it helps or not. So if it is zone 3 is not contributing to neovascularization, then we need a peripheral examination more anterior to the equator. So if we have an imaging system which is providing information about the posterior pole and mid periphery, then that is sufficient enough.
Yeah, that happens only in the conventional angiography also. I'm saying how come you're going to justify the usage of ultrawide field imaging if it is compared to
conventional
the
also there will be a montage creation, and the area calculation is very difficult with montage. And you have artifacts with montage, so ultrawide field will provide you a single image in which you can
artifact
measure
would
it.
be less in this. Yeah.
But I think comparative study would be the exact
Much
answer
better.
for this.
Yeah. Because again,
It
we've
was
come
a
back to
comparative
costing.
study.
Yeah.
It was
True.
a comparative study, but a cohort study will be.
Absolutely, absolutely.
Nice study. Thank you. Nice. Thank you.